We're back to the Neil Haley Show, and two areas we're going to discuss today: cardiovascular disease and also diabetes. Two of them, I bet you, when my guest is going to explain more and more, he helps fight and stop. So I'm excited to welcome to the program Dr. Zilin Wang. Dr. Wang, thanks for stopping by. And you know, when you talk about those two, how big of killers diabetes and also cardiovascular disease are really major ones that end up in the hospital and death compared to a lot of other illnesses that are out there, right?
Yes, yes. And cardiovascular disease is a leading cause of death in the United States and the Western countries. And it so far have no other disease can compete with it. So I have been practiced as a cardiologist for about 20 something years. And I've been practicing in China, in Japan, in the United States. It's nice to reduce the atherosclerotic plaque, which is a culprit of disease causing heart attack and stroke. So the plaque is really what is a fundamental problems. For years, people have been working around the plaque, never directly working on the plaque. So my practice just doing that, we have been doing that for 13 years. We have successfully reduced the plaque in the artery, and so that the patient doesn't have to go to cardiac surgery or stenting. So that's the way we've been doing. And we, at the beginning, before we start, was 70–80% of our patients had to go through the stenting or bypass surgery. Now in past 5 years, we have down to 1 patient per year. That's how much reduction we have. And not only that, patients' outcome is a whole lot better. Patients' functionality is better. Patients become asymptomatic, and patients have a more productive life. So that's what we've been doing. And that's what we call the plaque burden reduction therapy. And it's a non-invasive way to reduce plaques. And we have many patient cases there. And during this process, we find out if we don't treat type 2 diabetes, our patients' atherosclerotic plaque is not shrinking, not only not shrinking, but also started growing. So I have to tackle with type 2 diabetes as a cardiologist. And over past 7–8 years, we have patient reversed from diabetes, type 2 diabetes. We have patient and about 25 patients now from type 2 diabetes become a non-diabetic. In other words, they no longer meet the criteria of type 2 diabetes or pre-diabetes. I just saw one of the patients happened to be a hospitalist. He's an internist. I saw him today. He has been 8 years. He has taken no medication and meet the criteria of non-diabetic for 8 years. We have about another one, 7 years. Those are two longest. We have in the middle. And recently we have a patient, 60 years old, on insulin 62 units. We started working on him for 2 years now. He's off insulin for
fantastic.
Off insulin. And also amazing thing is when in the medical school, we've been taught diabetic peripheral neuropathy, once you develop it, you're never gonna be reversed. On him is a miracle because he no longer have the symptoms of a peripheral neuropathy, which is a numbness, burning sensation, heavy like a lead, and those are all gone.
So this is not really known in medicine a lot, Dr. Wang. A lot of times you're just kind of trying till it's too late, doing certain measures. By being preventative,
Yes.
how have you pushed for that? Because a lot of people in your field don't do that. What makes you
No.
so? Yeah, why did you decide to do that? Your thought process of really so that you can treat the problem a lot earlier than, or do it differently than just going to evasive stuff.
Yeah, the very reason I started because my motivation is to shrink the plaque in the artery. But when I find out I cannot do that anymore, I start to tackle with type 2 diabetes. When I start doing that, I find out if the hemoglobin A1C more than 5.7, they still have complications related to type 2 diabetes. Once I push the hemoglobin A1C below 5.7, all these complications started disappearing.
Oh, wow.
So I said, okay, the pre-diabetes diagnosis cutoff is 5.7. If your hemoglobin A1C above 5.7, you are pre-diabetic until you reach 6.4. When you reach over 6.4, you become a full-blown type 2 diabetes. So I said, why I just push down to 5.7 below? That way my patient all have a good outcome.
I see. So
And
you're really focusing on eliminating the type 2 diabetes. Then the plaque decreases in the heart, and then then you don't have as many heart attacks and deaths.
Yes.
Is that correct?
Yes. Yes. That's my motivation.
So what do you tell your patients to get that way? It's not through medication, that's for sure. What do you give them? What ideas and things do you do when you treat them so that you can get the type 2 diabetes to disappear?
I have developed a program called DRIP. DRIP stands for, is a DRIP, stands for Diabetes Reversal Intensive Program. So what I have find out, the type 2 diabetes fundamental problem is insulin resistance. Insulin resistance is a layman's term. You give a certain amount of insulin. Normally, you can reduce certain amount of glucose in your blood. That's how we check the blood. But for example, it's not a real true, but I just give a figure. For example, 1 unit of insulin can reduce 10 milligram per deciliter glucose. But when you become insulin resistant, you may only reduce 6, 7, maybe 5, 2 milligram per deciliter. So that's why you require more insulin to reduce insulin to the normal range. Over time, you make your beta cell, which produce insulin in pancreas, become sick, swollen, because they overwork. When reached to the certain point, which is their ceiling, they will stop working and they get a lot sicker. Some of them just died functionally, or maybe they just, so that way, when you have reduced significant number of beta cell not producing any insulin anymore, and others just sick, just already reached the ceiling, they can't produce anymore, you're gonna see your glucose in your blood start to spike very high. So that's the fundamental problem. So what I do is first, I try to increase insulin sensitivity. Number two, I will reduce the requirement of your body to produce insulin by reduce certain amount of medicine that trigger for diabetes, for glucose production. And then we reach to the certain point, we will put a patient called a hospital for beta cell to become bed resting. They just don't produce only minimum amount of insulin. Then we do just like the same thing, the hospitalization patient started going to physical therapy, which we slowly increase insulin, glucose, and therefore you slowly increase your work functionality. That's how we gradually restore all the beta cell function and not allow them to overwork. That's the whole process, what we do.
All right. So where can you find information on that? Do you have a website and stuff?
I have a website. The website have not a whole lot of information, but mostly it's in my Facebook page called Heart Care Plus. Heart Care Plus is my office name. So you can find a whole lot of case studies and the new patient reverse, and we'll put it in there, but we don't put all of them. Some of them, because they want to keep confidentiality, so we don't do that, but only we get permission from patients, then we'll put it in there and be in the testimonial cases.
All right. Well, we appreciate you coming on, Dr. Wang. It's great news to know there's a non-invasive way. And I'm sure you know providers all over the country that are doing what you're doing in Mississippi. So I appreciate you stopping by.
Thank you very much for the opportunity.
You're listening and watching the Neil Haley Show, and we'll be back in just a moment.